I was sitting at my kitchen table. It was 12:25 p.m. I was getting ready to go to a 1 o'clock dental appointment, which I never made, of course. And at 12:25, I was telling my significant other about one of my sons. And I stopped in mid-sentence, and she says, "What's going on?" And I said, I didn't say anything. And she looked at me, she says, "Walt, you're scaring me." And finally she looked one more time, she says, "Smile." And I did, part of the smile anyway. And she knew right away what it was. She says, "My God, you're having a major stroke." She was trying to get to her phone. At the same time, I was sliding to my right. I was going to fall off the chair. And she's trying to prop me up and hang on while she's getting to her phone, but she did. And she called 911, and they were there almost immediately.
We started giving him a TPA, and he improved pretty quickly. So we are very happy with the results. However, he deteriorated after a few minutes.
So TPA is a very good medication for most strokes. About 70% are small vessels. They're small little clots, you know, here or here in the small vessels, but it doesn't work very well for large artery strokes.
The opportunities that we can provide care from one facility to another in the East Valley and be able to provide this advanced approach to care through endovascular techniques really sets us apart and is heartfelt because we're truly making a difference for people in the quality of life that they can live if they're experiencing a stroke.
So when Walt came to Banner Desert, he basically couldn't talk. He could say some words, but he couldn't completely make full sentences. So he would say one word. He also had the inability to understand. So he'd follow some commands, but not all.
Emotionally, I don't understand what's going on. You don't understand it. I mean, for some reason, nothing comes out. I heard her ask the questions. I could hear that plainly, but I had no ability to answer them.
Here we have Walt's case. As you can see here, there's arteries. The black are the arteries. Here there's supposed to be a big artery here with multiple branches. You see it's all white over here. So the clot should be right here. What a stent retriever is basically, it's a stent that you expand and it sits there expanded and it integrates the clot. Okay, so it's a stent that goes up, but it's also attached to a wire, so you don't permanently leave it in there. And what you do is you basically leave it up there for 5 minutes, it integrates the clot, and you slowly pull it out. Okay, and that's really changed the face of acute stroke thrombectomies. Every trial that has used stent retrievers has shown much, much better outcomes with stroke thrombectomy than with TPA alone. Walt now is doing fabulous, actually. He's able to talk, he's able to walk, he's able to do everything he could before.
We've gotten some really great outcomes for our patients here because our goal is to be the destination site for neurovascular care, and particularly in the area of stroke.
By the time I left, I was answering questions, I was walking, unassisted, and able to do just about everything I wanted to save my life.